Nursing is definitely my calling. It was my calling. And I just love to help people. I enjoy helping people in my community, and it was my calling.
I always wanted to be a nurse. I admired the profession as a child. As I grew up, I didn't think that was going to be possible for me. I didn't think I could handle that. So I originally went into business management as my original field of study. But then after I had my first child and experienced care at one of the Memorial Healthcare systems, I decided to go back to school and pursue nursing. And I've been a nurse ever since.
I became a nurse because when I was in high school, my dad got very sick with cancer, and I really liked going to the hospital to visit him and see what a good impact all the nurses had on him, and he had a great outcome.
I became a nurse because I enjoy medicine and I enjoy taking care of people, and I can do that as a registered nurse.
I was thinking about being a nurse since I was very young. I always wanted to help people. I had to try to figure out how I could help people since I wasn't exposed to the healthcare setting as a young, healthy child. I was exposed in high school. I had a nursing program, an LPN program, and I decided I loved it. So I just kept going all the way up from, I worked as a PCA, as a nurse, as an LPN, and now I'm a clinical manager, and I just love helping and educating people on their health and trying to keep them healthy throughout their lives.
I became a nurse because I really enjoy taking care of patients. I like to see them get better. The looks on their faces when they know that someone really cares and is really interested in their well-being. That to me is the heart of nursing.
I chose nursing because I could help people at their most vulnerable time. It's very satisfying because you feel like you're helping people when they need the most help, and you see progress. It's something that you could never have with, I believe, with any other profession. It's just you're at a point where they need the most help, and you're there, and they share something with you that they don't share with anybody else.
Well, actually, when I was younger in the Philippines, I always wanted to be either a teacher or a physician or a pediatrician, actually. A lot of my family members were nurses, and I love nursing because it's kind of mix of both. You do healthcare and you do a lot of teaching to families, patients, so it came natural, and spending time with families and patients, that makes my day every time. That what I do with especially with the ICU, with the transplant program, the cardiac, I grew up in Jodi, basically. I came here as a new nurse, so here I am, having a good time in my career, in my life. I really just like what I do.
I became a nurse because growing up my grandmother was very sick, and I saw the impact of what a good nurse can do in a bad situation. They can make a big impact and a difference on both the patient and the family.
You know, on the drive home, when I have a chance to sit and reflect on my day, I think what sticks out for me the most is the personal connections I made, and really, I had a chance to give back to my community, but they also gave me so much in return.
So I became a nurse because I come from a family of nurses. My mom was a nurse, my grandmother, two of my aunts, and just growing up with them, always sharing their experiences and their stories, and just seeing how it changed their lives, it really inspired me to become a nurse. I feel like I'm a natural born nurturer, and my mom is a pediatric nurse, so just being able to see how it changed her life, it kind of put me in that direction.
Well, I became a nurse because nursing is that one profession that allows you to provide care and provide some special love to people that need it and families that are in need of help.